Hello and welcome to USTC360. I'm Dilbar Shatterson. From ancient times to modern times, the techniques and the way we access medical treatment has come a long way. Physically speaking, though, the human condition hasn't changed just yet. In a study of organized efforts to treat the needy, sociologist Renee Fox researched organizations like Doctors Without Borders and Doctors of the World. Like Tzuji's Medical Foundation, both groups have made huge strides in the arena of medical humanitarianism. In her analysis, Fox quotes Václav Havel, former president of the Czech Republic, when he says that the planetary civilization to which we belong confronts us with global challenges, but our inner self continues to have a life of its own. And so how can we make a difference in the global community? Well, by starting with our local ones. So here in the US, the Tzuji Medical Foundation has been doing just that for over 20 years now. So let's have a peek. On a rainy night, a bus brought a group of homeless people to St. Elizabeth Ann Seton Church in Rowland Heights, California. This was for the annual Tzuji Free Clinic held in Southern California for the homeless.
This is my third day here, my third day being homeless, but I don't intend to stay homeless. I was doing okay. I had a good life. I had a marriage and I had my kids, and it just kind of all fell apart. I had my private home, and I just somehow everything came to a screeching halt. The economy fell apart, and it just started snowballing.
My name is David Rosario. They call me New York. Here with the Winter Shelter, one of the coordinators, or just basically the guy that helps everything run. I work with them to help them and everything that they need, but I've been with them now for 7 years because I believe in what they do and how they help the homeless. Being homeless myself, they help me a lot, and I want to give back.
Because he knows how it feels to be homeless, people like David are a gateway. He and Tzuji medical volunteers help the homeless annually, and this year, as they wait in the rain. Since they don't have a permanent shelter, health conditions among the homeless sometimes take a back burner. Many of them face intense mental and physical hardship, though some do have health insurance.
I actually have Medi-Cal right now. Well, because the government changed it to Medi-Cal. It was another insurance called Healthy Way LA. It's lost the county, LA County Medical USC LAC hospital. So I had that. I had a Healthy Way LA because I'm of the low income status and I qualify now as eligible. So but it's time for me to also go back to work because work is really slow right now.
I have Kaiser, actually. Yes, I do. Like I said, you know what? This is just temporary for me. It kind of really caught me off guard and really kind of like humbled me big time. It really did. And it's kind of a good thing because you know what? I get to see how people really eat and live, you know what I mean?
The Tzuji Mobile Dental Clinic brings the spirit of curing people, curing symptoms, and curing hearts. They're on standby right behind the mobile sanitary van for the homeless.
I believe the Tzuji Foundation would be here for as long as I've been here, but I know the blankets started coming in about 6 years ago. One, because of the blankets that we get from them, which are donated to the organization, and also the dental truck that comes by, they even did some work for me, so very cool people, very good people. The haircuts, very good. I got a haircut just now, so it's good.
Tonight is the first time Tzuji's youth group, Zishao, has come to help serve hot meals. At the same time, Tzuji helps them understand what really happens among this often neglected population.
Especially for kids. I mean, we do have families, and I see the happiness when they're placed and when they get home, and the tears. It makes me feel good because I'm a part of that. Helping somebody out is cool. Okay, but some of them are hardheads, and we got to deal with the hardheads accordingly. Okay, because this is not camp. Okay, it's a shelter designed to help people, and sometimes these people forget that this is a shelter or they bring their own issues. We have staff to help them deal with that.
Before the medical service, Tzuji provided food and drinks. Veteran volunteers taught the new ones how to serve the meals the Tzuji way, with respect.
Beginning from December
Like a holiday party, volunteers gave their blessings to the audience while sharing stories. When the crowd heard of the one about Tzuji's bamboo banks, members of the audience took out the change in their pockets to donate and help others in need. Understanding the Tzuji Medical Group's selfless aid, the homeless here contributed to the cycle of love, hoping to help others. After their meals, paperwork, and blood pressure check, they headed to Tzuji's mobile van for service. Even in tight quarters, medical volunteers check patients' teeth with a smile.
They were nice and I appreciate it. And I thank your organization.
After the evening free clinic, they returned to the first free clinic Tzuji established in the U.S. in Alhambra. The free clinic has been running for 20 years and is now an official medical center. With regards to Obamacare, Tzuji volunteers help people fill in their applications to provide the best medical care for the people.
The setting in the Tzuji clinic is very different from our prior practice. In our prior practice, it seemed like we have a lot of resources. You know, a patient has insurance, and they don't have to worry about the expenses, and we don't have to worry about the expenses. So whatever the patient asks, whatever test they want to do, most likely we do it for the patient. But in Tzuji, not the same. The patient has no money, they don't have insurance, and we have to use a lot of our thinking, our experience to take care of these patients. So we don't go for a lot of tests.
一起，你就会变，你的静脉就会去这样子。这个在肛门的话就是痔疮。First of all, you're going to build up the relationship, build their trust, build their confidence on you, so they can then become very cooperative. You can tell you everything. When the patient tells everything, they will lead you to make a diagnosis, almost 80% to 60%.
A lot of doctors, they like it here. They like it here because it's a challenge to do just with two bare hands and the stethoscopes and, you know, and try to take care of the patient the best that we can.
I try to do everything for them. That's the reason we spend time here. If I'm thinking of making the money, and I'm not going to work here.
A feeling of trust, because the doctor explained very clearly and makes you feel at ease. They go through your medical history and what might happen to you in the future. It feels very comfortable.
And when I first came here, you know, I encountered a lot of diabetic patients.
So why does the sugar appear in the urine?
And I trained myself to be a diabetic doctor because I have no choice. Because I want to take care of them, I have to learn their disease. So I went to seminar, I went to classes, and read and try to make myself a better doctor. And I found that a lot of doctors here are like that. I'm not the only one.
And then
Student can learn a lot of things in the textbook, but a lot of humanity part, you had to go out, experience yourself.
In addition to Dr. Taw, Dr. Chen also continues to work with Tzuji's TIMA group through his retirement. Today he came to Fullerton, California, to Marshall B. Ketchum University. He hopes to enlist more optometry students to volunteer with Tzuji's optometry clinic.
Because we do so many things, not only locally, nationally, internationally, these all are very major part of our charity and humanity aspect. When you involve on this scale, after you had to witness the people who have been suffering much worse than you are, when you come back, you begin to realize that how lucky you are. That's why we would like this message to cross to the student mind. We do not want if possible, we do not want to have a student this very narrow-minded, just do your work, work. And we like them to explore the possibility. They will open up their heart, to help more needy people.
To serve additional populations, Tzuji's free mobile clinic went into the campus to serve low-income families. volunteers also invited local residents to join the Spanish translation volunteer team.
We're translators. We just translate whoever doesn't understand Spanish, like your doctors. And whatever they say, we tell them, and whatever they tell us, we have to tell them back. Because there's a lot of Latino population in this area, so it's not lost in translation.
Long time ago, we didn't feel that we have the side, really like this, to need medical outreach help. The Orange County, most in the population's impression, they're always thinking that they are in the very high-class area. But actually, next to the Orange County, there has a called Santa Ana area, because the school backpack program. Then actually we noticed that they actually have shadow place like this. There has a lot of poor people without insurance, and that they really need help.
My name is Lisa Solomon, and I'm the principal at Lowell Elementary School, which is the elementary school right down the street. We have volunteers from Suchi that work with our school, Emily too, and a group comes out and helps our students, and they help us with other things to help us be a happy campus. But she came, and her and Ivan came out and talked to us about this event and the services that they would provide, and how could we help to get our families here. So we worked together to get the flyers out, to make sure families got information, and that they knew about all the wonderful services that Suchi provides.
Principal Lisa is actively involved. She sees the whole district as her own family. When a student's family encounter problems, she tries to communicate with students and their families face to face in order to better understand and resolve the family's problem. Aside from academics, she comforts the whole family. It's touching.
What we did was we sent the flyers out with the students. We let the students know. We announced it on the loudspeaker at school. And then on top of it, we also did a phone call that we can call all 900 students in our school. I leave a message and it calls all of the students. So we were able to do that. We sent out about 4 of those phone calls to get the message out so people knew what Suchi was doing today.
From the Happy Campus program to free medical clinics, Suchi volunteers have reached out to local families through local school systems.
Welcome to Santa Ana Medical Outreach. This will be the first time in Santa Ana School District for the medical outreach, but that is not the last one.
We want all our students to be successful, and we know having good health helps them. That's why we appreciate all the hard work of the Suchi Foundation, the volunteers, and everyone who's helped out today.
Today we have 5 departments coming. So each department we need a bigger space. So that's why we chose into starting from the high school. Then I see how that go. And of course, other 4 or 5 elementary school, the teacher, they bring out, they really need it. Even they are in the very close in the same city, but actually the people, they lack of the transportation. Most of the time they walk or they take a bus. So in that case, we was thinking, we're starting from there, but we promise we will go to another location. Now we plan to do it 4 times for this year for those people. And hopefully we can taking care, and at least they feel they have someone to depend on, to count on how to get the health every day.
It's a great service to have, even with Obamacare and everything else, only because you're doing it locally. So a lot of our families don't have transportation, or they're kind of scared to get all the paperwork done and give out all that information. So by coming here, they're able to get the services immediately for whatever they may need, whether it's they want a blood glucose test, or they want to check their cholesterol, or they need something with their teeth, maybe that's been going on for a while. They feel more comfortable coming to school because it's a place that they know, and they know that you guys are working with us. The Suchi works with the schools, so they feel safer.
The Obamacare only for the people with the 133% of the federal poverty level, up to the 400%. Okay, this group of people that Obamacare can give them the medical service, and then they had to pay the government to get the tax credit for them. A certain group of people, number one, like illegal immigrants, they cannot do it. Or some young people, they don't want to do it because they think they don't need to get the medical care. And so even though the Obamacare, we still, right now, only about over 7 million people sign up. As a data from 2 years ago, you know how many people in the United States did not have medical insurance? Over 50 million.
To the dentist and the eyesight, that she really needs the dentist badly because she doesn't have insurance. Like, she does have insurance, but the dentist costs a lot of money.
Many parents find out about the free clinic from their children. However, many of them don't speak enough English to come alone. This patient here was able to receive optical treatment in part thanks to her daughter's help. Most often, Tzu Chi optometrists encounter a condition called presbyopia in many patients. After examination, they are able to receive special prescription glasses.
I will pick the frame according to patient's need. Of course, the prescription is based on what the doctors provide.
Okay, todo bien. Me están atendiendo bien.
Every time I see them being able to see clearly, their facial expressions make me feel joyful.
The school from Lincoln Elementary School told me there's going to be something for kids here. Take her in. Maybe they can help you. Maybe they can guide you. And that's why I came over here, to see if they can guide me, to have her taking care of her teeth, and then move on to our next step.
Okay, let's go to the dentist and see doctor, okay? Even they feel they might be got sick, but they don't have anywhere to go. So if we come out for the medical outreach, at least they can come in, they know it's free. They're able to see how's that go, okay? Maybe they can get some information, and also besides, they can get some treatment.
This is my granddaughter.
Oh, granddaughter. Mm-hmm. How old is she?
She's 9 years old.
Okay.
Starting with, Tzu Chi Foundation. Then after that, if it really has a serious problem, we can refer to the local free clinic. Then, and also teaching them a little bit knowledge, how to maintain and where to seek up the help.
He told me what to do, and that's important to me. Now all I have to do is take her over there and get the services done. He said, because at a regular hospital where she's going to be, they won't do it. At 10 o'clock.
Usually they put the seat. Yeah. Okay?
Okay.
All right.
Thank you.
Okay.
One of the advantages of a mobile-free clinic is that it reminds patients to be more vigilant about their health, and another to increase the overall health of the community. Still, the spirit of Tzu Chi TIMA's doctors is to extend emotional support to the patients.
Prevention is better than treatments. This is the important part. Instead of having the patient to see doctors continuously, why not teach them how to prevent illness?
To educate patients about home care, Dr. Wu and her team created a pamphlet for pain treatment.
When patients go home, what can they do? What do they have to avoid doing to reduce patients' discomfort? At the back of the pamphlet are the pressure points for their pains that they can massage on their own.
Hi, hello.
The Tzu Chi Medical Association can offer for the children. Number one, we can offer preventive education, which I consider the most important. That's why we try very hard to do it, and especially for major cancer group: colon cancer, stomach cancer, breast cancer, and liver cancer. And then we can do the education for the dental hygiene and also pharmaceutical, nutrition.
The doctors who participate in Tzu Chi's weekend clinics demand no pay for their services. Instead, they tout payment of a different kind.
The goal of our life is to service. I feel helping others is the greatest joy. I feel doing this is very worth of my time. I'm truly joyful. Seeing people who are suffering to feel better, I feel joyful. This is my motivation.
所以就会这个就是动力。So far, so good? Oh, good, good, good. I'm happy for you, okay?
Master Chen Yan, our master said, if every location, if we can taking care of those people, and it's just like a puzzle, and everybody put together, that's the vision we look into it, and make everybody's life better and no suffering.
I feel very privileged because I'm able to interpret, for people with the same nationality, and let them know that there's other people with different cultures who are willing to help.
When the patient come in, the local patient come in, they know where is the Tzu Chi come from, okay? And where's the money we have able to do this action? Where's the money come? So you will see the bamboo bank, because we want them to understand, how important if everybody has that compassion, and this world will get much, much better. Because money, poor money is not what donated by the rich people. Even in the local, everybody, able to just 1 cent, they have that compassion, love, will make this world wonderful.
I think Tzu Chi is amazing. It makes me want to cry because Tzu Chi has done so much to help my families at school, my students, and also the whole community. It feels like there's people who care and who really want to help our families to do better, whether it's through education or through health or just providing basic things that our kids need, whether it's shoes or backpacks. Tzu Chi has done a lot, and I don't think I could ever thank Tzu Chi for everything that they've done. You guys have been, the whole organization has been amazing, amazing.
As medical volunteers are working hard to service the patients that are in critical need, there's still a lot of sleeve rolling to be done. While Obamacare, or the Affordable Care Act, is slowly taking effect here in the United States, there are still millions of Americans for whom it doesn't cover, specifically undocumented populations. So perhaps now, more than ever, free and easily accessible medical services are needed, but only as much as volunteers can help support. And as we saw, such efforts demand not only the skill of a good doctor, but also the skill to cross cultural barriers. In fact, going back to Havel's speech, he says that the main goal to be achieved in our time is the creation of a new model of coexistence among the various cultures, people, races, and religious spheres. And so the Tzu Chi Medical Foundation continues to serve the global community, and in huge part, thanks to your support. Thanks for joining us. I'm Dilbar Shatterson, and I'll see you soon.